Hi, I'm Marguerite Barnett, owner of Mandala Medi Spa, and I'm a double board certified plastic and general surgeon. Today's topic is Botox and other neurotoxins. What you need to know. What is Botox? Well, it's in a classification of something called a neurotoxin. Now that sounds pretty nasty, but there are some things that are pretty dangerous that we don't even think about, like driving around in cars. How many of us die every year in our vehicles or are permanently maimed? Other things that we don't think of as very harmful sometimes can be quite deadly, like Tylenol. Every year several dozen people fatally overdose. It's a really difficult overdose. I'd rather deal with heroin overdoses than Tylenol overdose. So Botox is in a category, I think, that's actually safer than aspirin. It's really a poison, so it does need to be treated with respect. It's been out since the mid to late 80s, and we have a lot of safety data on it, and as I said, the safety profile, in my opinion, is better than aspirin. Basically what it does is it paralyzes muscles. If you eat a bad can of botulism beans, it paralyzes your breathing muscles so you would suffocate and die. But someone got the bright idea, if we used a tiny amount of the neurotoxin, not enough to paralyze anything other than an unwanted muscle, like a frown muscle in your brow, we'd be able to treat wrinkles that are caused by those muscles. And it's really been wonderful. It was originally used for blepharospasm because there's some people whose eyes go into so much spasm they can't even open their eyelids and are practically blinded. The ophthalmologist began injecting it into those muscles to weaken them and prevent the spasms. And they found the patients were coming back saying, you know, my kids say it's time for my Botox shot. I've got the mean look back. And that's when they realized it was good for wrinkles. So the amount of Botox that is given is small enough that even if we mainline an entire vial of the medicine into you, you couldn't be killed. But as I said, it is a powerful poison, and it's been in the news in a bad way towards the end of 2004. Some idiots ordered fake stuff over the internet, and 4 people wound up hospitalized. So you need to know what the products are. Currently, we're at the beginning of 2013, and there are 3 products that are approved by the FDA. Now these are the 3 products currently approved by the FDA in the US as of early 2013. This is Botox, onabotulinum toxin, Dysport, avobotulinum toxin, and Xeomin, incobotulinum toxin. Make sure you see the product. These 2 products come freeze-dried, and this one can be stored on the shelf. This is a vial of the Botox, which comes in a little purple holographic vial. This has a green holographic vial. And this vial is kind of a little blue cap. All of these vials have to be reconstituted with saline. Once we reconstitute it, it makes a liquid which can be drawn up into a syringe and injected. For purposes of demonstration, this is Botox, and we don't need a huge amount. Depending on the dilution, a very small amount. Now, just to give you an idea of the type of needles that are used, this is the typical needle size for injections like kind of flu shots you get. This is the typical Botox needle. And you can see it's a very, very tiny needle. That's good news for you guys. It's about the same size as an acupuncture needle, and you know, acupuncture generally doesn't hurt unless you get right over the bone. So if you use an ice pack, you're less likely to get bruising, and these little needles will not harm. The amount injected depends on how many units you need and the dilution that the doctor has. But the amounts are very, very small. You might have a little bump where the needle goes in, but that'll disappear very quickly. So I wouldn't be afraid of it, and most people tell me it's not that bad. Okay. Now we're going to demonstrate the injection of Botox on our model, and some people will squeeze on the little ball if they feel any pinch, but most people, since it's such a tiny little needle, are not going to feel any pinch at all. Kathy has some little frown lines. Frown for us, Kathy. Okay, relax. Now, you're going to feel a little pinch right between your eyes, and there we go. And then there's going to be a little pinch right over. These are a bit more pinchy on either side because the nerves are around them, so I apologize beforehand. And then, as you can see, virtually no bleeding because these are such tiny little needles. We're going to cool her down a bit more. Typical dose for the forehead is 20 units, but some people only want to treat these. I've drawn up 20 units at a particular dilution, and these are what I call the crunchies. Crunch 1, crunch 2, crunch 3. How's the pain level? You don't have to lie.
No pain, so you feel a little pinch like a bee sting, and that's it.
That's it. Now these little bumps, as we said, will go down. Some people use the smaller dilutions, but I find it hard to be accurate using the smaller dilutions, so we do get a little bump from the injection. So she'll just keep this on. In about 15 minutes the bumps will be gone, and she'll see results within the week. Thank you.
You're welcome. Thank you.
Okay. These products come freeze-dried, so they have to be reconstituted with saline, which means that we inject saline into the vial and mix it up. Once it's mixed, we have a finite amount of time before it begins to lose its power. In the beginning, 4 hours was the amount of time you had to inject it, but the newer formulations allow you up to 24 hours. It can actually be used past that time, but it is not as strong. And that's why I like to educate my patients about this factor, because some doctors, if you will notice, there are 100 units in the vial, and typically we're going to treat people with somewhere in the vicinity of 20, no more than 32 units at a time, unless there's something very unusual, and some people will only require 12 units. So obviously I can treat multiple patients out of a single vial. If you don't have enough patients to load up on a single day, and even if you do have enough patients, it always seems that the last patient of the day needs a few units more than you have in your original vial, and you have to open up an entirely new one. So some doctors who are a little unscrupulous might put it away and use it several days later. I don't throw it away because it still works. I use it on myself. My staff gets the benefits of the leftover Botox. And occasionally I have a patient who's on a real budget, can't afford it at full price. They can also benefit. But I don't think it's ethical to give it at the full price. So know when your Botox was mixed up. And if the doctor is giving it around the clock, day in and day out, either they're very busy with their Botox practice or they're probably storing it. Another way that people can get fooled is by the dilution. The company gives you a certain number of dilutions to give you a uniform dose so you know what the effects will be. But some doctors will over-dilute and make it not quite as strong. I've had patients say to me, you know, Botox doesn't really work on me, and I don't want to say anything negative about their doctors, but chances are they're either getting over-diluted or old Botox. So be sure you know how many units you get treated with, because that is a standardized amount, and you should get a standard reaction. Or if you're like the majority of my patients, the more we use it, the less we seem to need it. I originally started using it for a single wrinkle here, which I don't mind some wrinkles, but it made me look angry all the time, and I really didn't feel angry all the time. My employees were asking, what had they done? Why was I pissed off? It worked great for the wrinkles, but the bad thing is it doesn't last forever. How long does it last? Well, basically it binds irreversibly with the neuromuscular plate. So after about 4 months, those plates get regenerated and you're going to have muscle action back again. The first year that I used it, I noticed the muscles were moving in 3 to 4 months, but the wrinkle took closer to 5 or 6 months to come back. And by the second year, it was sneaking up a little longer. By the third year, it was even longer. What I think happens is some people, if they break a bad habit such as frowning, forget to do it in the future. I know I was squinting when I was reading, so since the muscle was paralyzed, I began to forget how to do it. The other thing that happens with a paralyzed muscle is you begin to weaken the muscle. It atrophies. So my muscles flattened out, and even though they could wrinkle, they weren't thick enough for the wrinkle to be visible. So with regular use, many patients find they need less. So make sure you know what your dose is and that the doctor is legitimate in using approved Botox, or there are some other similar products, which is why we call it neurotoxins, for use in humans that have been approved at this point. The different neurotoxins work basically the same way. They're just made by different companies with different processes. Each company claims its product is better than the other. There are some advantages and disadvantages to each of them, but for general purposes, they're all pretty much the same. Dysport is more purified, and Xeomin is even more purified. There will be more, so Xeomin doesn't even have any of the proteins around it that the other two do. The smaller molecules can diffuse faster, so apparently one advantage of small molecules is they will go to work faster. Botox itself doesn't go to work immediately, so you don't walk out of the doctor's office with the wrinkle gone. It usually takes a day, sometimes up to 9 days to go to work. In my experience, Dysport goes to work in generally half that time, usually by the next day and up to 48 hours later. I haven't got so much experience with Xeomin, so you'll have to wait on a report on that one. But some companies claim their product will last longer. I don't think that's the case, since they all work by the irreversible attachment to the neuromuscular plate, and the rate at which that's synthesized will vary on your genetics, not so much what product was put in. So the advantage of Botox is it's widely known, has a good track record. As far as we know, it's a pretty good product. It's a little more expensive than Dysport. Dysport spreads a little bit more, which some people feel is an advantage, as well as it going to work faster. What are the possible risks of using these products? Well, other than hitting a little blood vessel and causing a bruise, which is why you should not take any aspirin, fish oil, or anything that makes you bruise for a few days prior to coming in for your neurotoxin injections. The only other possible complication, occasionally like a headache, although we use these products to treat headaches, so that's a pretty rare one. If you get too close to the corner of the brow, some of the medicine could drift down and cause an eyelid droop. I've had that happen 3 times in the 17 years I've been injecting, so a careful injector should be able to avoid that complication, but sometimes it happens. In the first patient that it happened to, she didn't notice. It was very slight. One eyelid was not as open as the other, and I knew it would wear off quicker than the 4 months that it usually takes. The other 2 were noticeable. The good news is one wore off in 2 weeks and the other slightly longer. And there is an eye drop that one can use that will stimulate the muscles to open. So as long as that eye drop was used, they didn't look so bad. That's been the worst I've seen. So just be sure you go to an experienced injector. The other possible complication would be someone who would be unusually sensitive to such a product. Typically, we would worry about someone who has a strong family history or personal history of paralytical disorders such as myasthenia gravis or ALS. In a case like that, it's probably better to avoid these products and consider other options. Other than that, as I said, an excellent safety record. Only bad thing is it doesn't last forever, but it's basically done away with a significant amount of my brow lift surgery, and I'm not sad about that because there's plenty of other things I can be doing. So enjoy it. Just remember the safety issues. It is a powerful poison, so don't be doing it willy-nilly at Botox parties. I think it's a true medical treatment and should be treated with respect. Minimal complications as long as you stay away from blood thinners. And don't wait until the last minute because it'll take a day or 2 to go to work. Thank you very much for your consideration.